Good day everyone. In this video, I will be discussing the cranial nerves and spinal nerves of the horse. Cranial nerves of the horse is a complex network of nerves that run from the spinal cord out into the body and limbs of the horse. Most of these major nerves branch off to the spinal cord before making their way out into the body, where they help send signals to and from the brain. But there is a special set of nerves that originate not from the spinal cord but from the brain itself inside the cranium of the skull. These nerves are referred to as cranial nerves and are numbered using Roman numerals. This series of nerves help in the function of many systems of the horse, and problems in any of these nerves can affect the whole horse. The cranial nerves all have their unique functions and will always be found in pairs that branch to each side of the body. Some of the cranial nerves are for sensory input and will relay messages to and from the brain. Other nerves are used for motor function to help control muscle movement. Some pairs of nerves serve both sensory and motor functions. All the 13 nerves but cranial nerve 4 exit the brain on the bottom or the ventral surface and then pass through the small openings in the skull called foramen. Cranial nerve 4 exits the brain on the top or the dorsal surface but immediately follows down to the bottom of the brain to join the other nerves. The first two cranial nerves both deal with the sense of smell. The first nerve is the cranial nerve 0 and is called nervus terminalis. It is associated with sensing pheromones and helps to trigger mating behavior. Cranial nerve 1 is the olfactory nerve and is responsible for the horse sense of smell. Both of these nerves are sensory nerves and only relay information about smell to the brain. The signal from these nerves do not travel to the thalamus of the brain, so there is no delay in the sensory input. Thus, this information can instantly trigger the fight or flight process and evolve for survival. Cranial nerves 2, 3, 4, and 6 are all associated with vision and the eyes. The optic nerve or the cranial nerve 2 is responsible for vision and completely a sensory nerve. The cranial nerve 2 transmits sensory information from the retina of the eye on to the brain. Possible issues is these nerves will affect the horse vision, which may present with the horse bumping into things and spooking on the affected side. The cranial nerve 3 or the oculomotor nerve, the cranial nerve 4 which is the trochlear nerve, and the cranial nerve 6 which is the abducent nerve are a motor nerve and responsible for eye movement, pupil size, and focusing on the lenses. One of the most important cranial nerves to remember is the cranial nerve 5 or the trigeminal nerve. It is complex nerve that has 3 branches that travel out into the head of the horse. This nerve is both responsible for sensation to the head and face, but also motor function to the chewing muscles. The information sent to the brain covers everything from temperature, pressure, proprioception, and pain. The 3 branches of this nerve are the ophthalmic, maxillary, and mandibular portions. Pain stemming from dysfunction in this nerve can cause behavioral issues such as head shaking, head tossing, chewing on the bit, difficulty breathing or haltering, sensitivity to the head or pull area, tensed muscle of the jaw, or a number of other unwanted behavior. 3 nerves are associated with the tongue and the muscles of the face. These are the facial nerve which is the cranial nerve 7, glossopharyngeal nerve, which is the cranial nerve 9, and the hypoglossal nerve, which is the cranial nerve 12. The facial nerve is responsible for the motor function of the facial muscles, but also sensory input from the tongue for taste. The hypoglossal nerve is responsible for motor of the muscles of the tongue. The glossopharyngeal nerve is responsible for swallowing and some motor movement. Issues with these nerves can show up as facial asymmetry, drooling out one side of the mouth, difficulty drinking or eating, or partial paralysis of the tongue. The vestibular nerve or the cranial nerve 8 is responsible for hearing and the horse's balance. This nerve sends sensory input from the inner ear to the brain, where for balance and proprioception, it is motor control coming from the nerve. This proprioception, it is motor control coming from the nerve. This is a key nerve to look at for horse having hearing problems, head tilts, or any balance issues. The vagus nerve or the cranial nerve 10 is the only cranial nerve that extends beyond the head and the neck of the horse. It is mainly a sensory nerve but does have some motor functions. This nerve helps with sensory of the gastrointestinal tract and respiratory tract, motor to the larynx, and parasympathetic motor to the abdominal and thoracic organs. This nerve can play a role in horses who have issues breathing like roaring, along with horses with digestive issues. The spinal accessory nerve or the cranial nerve 6 is a motor nerve for the muscles of the neck and withers. This is not a sensory nerve but provides motor control for movement of the neck in the horse. While there is no sensory input, this nerve can be compromised by poor saddle fit, improper neck positioning, under saddle, and horses overworking the neck muscles. All of the cranial nerves are vital to a horse's day-to-day activities, and when not fully functioning can affect the whole horse. It is key to have a full veterinary workup if any horse is showing issues that might relate to the cranial nerves. Next is spinal nerves. Spinal nerves are grouped as cervical, which is 1 to 8, thoracic, which is 1 to 12, lumbar, which is 1 to 5, sacral, which is 1 to 5, and coccygeal, depending from which segment of the spinal cord extend. Segmentation of the spinal cord corresponds to the intrauterine period in which the spinal cord occupies the entire vertebral canal. Spinal nerves, however, exit the vertebral column at their corresponding numbered vertebrae. Cervical spinal nerves exit through the intervertebral foramina directly above their corresponding vertebrae, while thoracic, lumbar, and sacral spinal nerves exit directly below. In order for more spinal nerves to exit, they must first descend through the vertebral canal, since the lumbar and sacral spinal nerves are the farthest from their intervertebral foramina. They are the longest. While descending towards their corresponding intervertebral foramina, lumbosacral spinal nerves form a bundle called the coda equina, meaning the horse tail. Each spinal nerve has an anterior and posterior root. Anterior roots transmit motor information, and they originate from the anterior horns of the gray matter and exit the spinal cord through the anterolateral sulcus. The posterior roots transmit sensory information and have sensory ganglion attached to them. They originate from the posterior horns of gray matter and exit through the posterolateral sulcus of the spinal cord. Anterior and posterior roots merge just before the intervertebral foramen and form the trunk of the spinal nerve. The trunk is very short, and soon after exiting the vertebral column, it divides into four branches: the anterior ramus, posterior ramus, communicating ramus, and meningeal ramus.